In a study conducted by the AVMA, which is the American Veterinary Medical Association, 50,000 pet-owning households were surveyed, and it was concluded that dogs are the leading species of pets in the U.S. As a part of your family, maintaining a healthy pet is very important. The best way to do this is by making sure your dog's vaccinations are up to date. Hello, my name is Beatriz Andarcio, and this is my presentation on animal health for CHM 1045 class. I will be discussing the importance of giving your dog its core vaccines, as well as dispelling some misconceptions. At 1 month old, puppies receive their first round of core vaccines: distemper, adenovirus, and parvo, or DAP for short. Why are these considered core vaccines? These three infectious diseases are the most contagious for dogs. Therefore, it is imperative the shots are administered and several times in the first year of the dog's life to increase immunity. Over the years, there has been a steady decline in pet vaccinations due to the general public's opinion over the importance of animal health. How can we keep our pets healthy? Just like humans, we need to make sure we provide our dogs with basic nutrients. In moderation, of course. Here's what you should look for in your everyday dog food. Calcium, magnesium, and vitamin D will help strengthen your dog's bones. Phosphorus will regulate the nervous system as well as help coagulate the blood. Sodium will help regulate fluids inside the body. And finally, vitamins A and E will provide your dog with powerful antioxidants that boost the immune system and fight the effects of aging. A deficiency of any of these can cause a decrease in the strength of the dog's immune system and give way to bigger problems. Let's look at the three most contagious infectious diseases that can compromise your dog's life, starting with the canine distemper virus, or CDV for short. This virus can easily be spread airborne or just by direct contact with an infected object or person. It can even be transmitted through the mother's placenta. In the picture provided, we can see some physical symptoms of CDV, which are ocular discharge, cloudiness of the eyes, a dry nose with scanty discharge, and keratinization or hardening of the pads. Infectious canine hepatitis, or ICH for short, is spread through contact with urine, feces, saliva, and respiratory secretion from another infected animal to the next. The dog may develop corneal edema, swelling of the cornea, and jaundice, which is a yellowish or greenish pigmentation of the skin caused by the virus attacking the liver. Canine Parvovirus, or CPV for short, is often confused with CDV because their symptoms are so similar. This virus is spread through direct contact with an infected dog, environment, or even a person. For infection to take place, though, the immune status and the number of viruses the dog has been exposed to has to be considered. All three of these viruses attack the respiratory, gastrointestinal, and nervous system, with the gastrointestinal system being hit the hardest. All three viruses will begin replication in the throat or lymph nodes and then travel through the bloodstream towards the lungs, bone marrow, and the stomach lining, which is the epithelial. The viruses will kill the white blood cells they've attached themselves to while traveling through the bloodstream, which causes immunosuppression, and this leads to further infections. A fever will ensue, and after a week, a dog infected with any of these three viruses will show signs of diarrhea, vomiting, weakness, and depression. Just as in a human being, a dog's stomach lining helps absorb important nutrients and provides a crucial barrier against any fluid loss and bacterial invasion into the body that the gut has stored. Through the diarrhea, the dog releases fluids and nutrients, which leads to dehydration. It is important to mention that there is no specific cure for any of these viruses. Treatment will be strictly symptomatic and prophylactic. Usually antidiarrheal, antibiotic, anti-seizure agents, and intravenous fluids are administered along with strict hospitalization. The medication will fight against secondary infections and give the dog's immune system time to catch up. What exactly is a vaccine anyway? Just like a vaccine meant for humans, a canine vaccine can be a preparation of either a killed or altered microorganism. The weakened virus will stimulate the host's immune system and learn how to fight against the microorganism. Depending on the immune system status, the dog will either not get sick or have a minor illness. The intervals for a puppy's core vaccines are usually 8, 12, 16 weeks, and then, as adults, 1 year later, then finally every 3 years. Ideas on how, when, and if your dog should receive its vaccines are constantly a popular topic among pet owners. Here are 3 most common misconceptions when vaccinating your dog. Vaccinating my dog just once is enough. Just one time would not be enough for your dog because you need to give their immune system enough exposure to the virus to build an appropriate immunity. I must vaccinate my dog as often as possible. With every dose administered, the risk of your dog developing side effects increases. These side effects include fever, vomiting, and diarrhea. After the first year, vaccinations will be every 3 or 4 years. Vaccinations are harmful. Vaccinations do not come without risk. This is why it is important to administer through intervals. It should be noted that development of adverse side effects and possible death is much higher in unvaccinated dogs than in vaccinated ones. Here are 7 ways you can keep your dog healthy, provided by the American Veterinary Medical Association. In conclusion, it is imperative to take certain steps to lead an easy, healthy lifestyle for your pet. Thank you for your time. My name is Beatriz Andarcio, and I hope you enjoyed my presentation on animal health.